Okay, good morning everyone. I am Dr. Tracy. So previously we have discussed about HPV virus and today thank you for joining us. Today we have Dr. Benjamin Chow to discuss with us regarding hepatitis A and also hepatitis B vaccination. So Dr. Benjamin, what is hepatitis A?
Good morning, everyone. Welcome back to our series of lecture and talk regarding vaccination. So today I'll be talking a bit of hepatitis A and hepatitis B. So what exactly is hepatitis A? It's just an inflammation of the liver that is caused by hepatitis A virus.
So 什么是 A 型肝炎呢？A 型肝炎就是由 A 型病毒导致的肝脏疾病。So next, what is the hepatitis? How is hepatitis A spread?
A lot of people will probably have heard this. A lot of doctors say that when you go for frequent traveling, you should get yourself vaccinated with hepatitis A. So hepatitis A virus, how we get it is usually by ingestion into our body. So it's usually by food that is not cooked properly, food that is contaminated or dirty that is have this hepatitis A virus. Those are how we usually get hepatitis A. And another way of getting is sometimes we don't wash our hands. We may be touching things here and there, and because of the lack of hand hygiene, this when we eat the food with our hand, that also may cause the hepatitis A virus to get into our body. And of course, the other two things is a bit more small percentage, but some people having sexual intercourse and also using illicit drugs like what you call it, using needles and all that, those also may cause the transmission of hepatitis A virus.
Okay, so A 型肝炎是怎样传播的呢？通常 A 型肝炎是通过摄取污染的食物与食水来传播的。除此之外，不良的个人卫生如手肮脏或者是不安全的性行为与注射毒品都能导致 A 型肝炎。What are the symptoms of hepatitis A?
Hepatitis A symptom is quite broad spectrum. A lot of them they present with nausea, vomiting, they feel very fatigued, they feel tired. Some of them may present with high-grade fever. A classical symptom of hepatitis B that is more towards them is they may present with yellowish discoloration of the skin. They have pale stool, dark color urine, and in fact most of them may have a lot of joint pains and abdominal pain.
Okay, so 接下来我们要讲的是 A 型肝炎到底有什么症状呢？So 通常人家都会发生这个发烧，然后关节炎，然后觉得他的尿非常的深色，大便比较偏向白色，然后眼白或者是皮肤都有黄色的颜色。So what are the complications of hepatitis A?
This part I will explain a bit more detail. A lot of time hepatitis A is very mild, is resolved by itself. We call it a self-limiting disease. What it means is it will get better by its own. But unfortunately, there's a percentage where patients are infected with hepatitis A, they get kidney failure. After that, their pancreas will get inflamed, which is known as pancreatitis. Those are very dangerous because you affect your body system in the overall manner, and your bone marrow become a bit haywire, where you will produce your white blood cells, your red blood cells in an abnormal manner. And of course, you have your joint pain, your joint inflammation causing a thing called arthritis. And one of the things that a lot of people do not know also is when you get hepatitis A, you may resolve or cure from it, but you may have a relapse, meaning it may actually come back.
Okay, so 大多数的 A 型肝炎都是会自然的康复的，可是有小许的 A 型肝炎可能会发生一些并发症，例如肾衰竭、胰脏癌。我们的骨髓可能会被压抑，导致我们的红血球、白血球跟血小板都偏低。除此之外，它也可能会导致你有这个风湿，跟有这个 A 型肝炎可能有复发的可能性。So how is hepatitis A treated?
Despite our medical advancement for decades, there's still at the moment there's no medication for hepatitis A. There's no cure. But when a person is infected with hepatitis A, the only we call it conservative and supportive. What it means that, for example, you have vomiting, we give you anti-vomiting drugs. If you have fever, we give you the Panadol, just supportive, and that's the only thing is available for hepatitis A at this moment in time.
So 到目前为止，A 型肝炎是没有药物治疗的，可是我们会针对病人的症状给予治疗。The next one we will discuss a bit regarding hepatitis B. So what is hepatitis B?
It's the same thing with previously. Hepatitis B is the inflammation of the liver that is actually caused by another virus called hepatitis B virus.
Okay, so 我们的 B 型肝炎是由我们的 B 型病毒导致的肝脏疾病。How is hepatitis B spread?
Just now I talked about how hepatitis A is spread. It's spreading through food. They call it by ingestion. Hepatitis B is a bit more to body fluid. That means from your blood, from your semen, vaginal fluids. That's how it's being spread. So, for example, having sexual intercourse without a condom, that's one way it's spread. By passing from a mother to a baby during pregnancy, that's another way that's been spread as well. And the other two things is by injection. So by using those people taking illicit drugs, sharing needles, and the last one is actually blood transfusion and organ transplant. Those are the way hepatitis are being spread or transmitted in our population.
So B 型肝炎是通过血液来传播的。So 传播的媒介例如不安全的性行为，由传染的母亲传播给婴儿，不安全的注射病毒与输入一些受感染的血液。What are the symptoms of hepatitis B?
Both hepatitis A and B, the symptoms are pretty much overlap. It's the same thing. You will have your fatigue, feeling very tired. You have nausea, some will present vomiting, and the classical symptoms will be your yellowish discoloration of your skin, then at the same time passing dark color urine, pale stool, and abdominal pain, and also at the same time your joint pain.
So B 型肝炎的症状其实跟 A 型肝炎大致上都是一样的，就是我们的眼白跟我们的皮肤都是有黄色的症状，然后我们会有发烧、肚子痛。肌肉疼痛跟觉得很疲惫。What are the complications of hepatitis B?
The complication of hepatitis B, a patient that's infected with hepatitis B, is a bit different from hepatitis A. Like I told you earlier, hepatitis A is self-limiting, it will resolve by itself. But for hepatitis B, it will be dragged. So two things that we're worried about. One of it is called hepatic encephalopathy. What it means is your hepatitis B virus will infect your central nervous system, your brain. So what happens when the people has this sort of thing? It will go into fit, they'll go into seizure, they'll go into coma. Those require intensive care management. And then the other one, what we worry about, is the event leading to liver cancer, or we call it as hepatocellular carcinoma. So what happens is, we have a healthy liver. So if a person infected with hepatitis B virus, the first thing you'll take a bit, about 5 years or so, you'll develop into chronic hepatitis. What it means is a long-standing inflammation of the liver. And after that, because of the long-standing inflammation of the liver, you'll lead to a thing called liver cirrhosis, where your liver become hardened. You'll shrink and become hardened. And then the next step after that, you'll lead to a possibility of getting a liver cancer. So that's what we're worried about when a person is infected with hepatitis B.
Okay, so 简单来讲 ，B 型肝炎有哪些并发症呢？So 当你长期有这个 B 型肝炎的病毒，你就会有这个慢性的B 型肝炎，因而会导致我们的肝硬化。过后有肝硬化的病人都有高风险得到这个肝癌的可能性。How is hepatitis B treated?
Same with hepatitis A. At the moment, there's no curative treatment, there's no cure, but there are drugs available to suppress or to lower your hepatitis B viral load. So as just now I explained earlier, we have inflammation of the liver caused by hepatitis B virus. So there's these antiviral drugs that acts specifically for hepatitis B to lower the viral load. Number one, that is to prevent transmission, prevent spread, and number two, prevent further damage to your liver. And another thing, they may give a thing called interferon. What the drug does is try to boost your immune system against the hepatitis B virus. So it lowers down the viral load and to prevent the complication of hepatitis B.
So 这个跟 A 型肝炎一样，我们也是没有药物可以完全治疗这个 B 型肝炎。可是现在的市场上，我们有一些药物可以压抑这些病毒的繁殖，然后这个因而可以减少我们得到肝硬化与肝癌的风险。So, how do we prevent hepatitis A and also hepatitis B virus?
Again, from my previous slide, I've explained clearly and in a simple way how both hepatitis A and B is being spread. So we go back to the basics. So number one, proper cooking method. Make sure your food is all fully cooked. Avoid contaminated or food that is dirty or with poor hygiene preparation. And number two, practice proper hand hygiene. I mean, not just because of COVID-19, but this will also prevent hepatitis A and B transmission as well. And after that, of course, practice safe sex. For those that are in this group, wear condom and do not share needle, razor, or toothbrush with anyone. And lastly, blood transfusion. So whoever that goes in blood transfusion, make sure your bloods are all screened for both hepatitis B and C. And lastly, the best way to protect your loved ones, protect yourself, is get yourself vaccinated by hepatitis A and B vaccine.
Okay. So 当我们知道这个 A 型肝炎与 B 型肝炎是如何传播的时候，那么我们就知道我们到底要怎样预防这个肝炎。So 最重要的是我们要保持个人的卫生整洁，例如勤力的洗手，安全的食水，与不要进行不安全的性行为。可是最重要的还是我们可以注射这个预防针来预防这个肝炎。So, what is hepatitis A vaccination?
Hepatitis A vaccine is a 2-dose series. We take one shot now, and the other is given 6 months later. So it's quite safe and is recommended for most people.
Okay, so 我们的 A 型肝炎疫苗是需要2次的注射，第2次的注射是6个月后。What is hepatitis B vaccination?
Hepatitis B vaccination is a 3 series of doses in the span of 6 months. You take it now, 1 month later, and then 6 months later, 0, 1, 6.
Okay, so B 型肝炎总共要注射3次，第2次的注射是第1次注射后的1个月，第3次的注射是6个月后。So now we have a few questions from the floor. So the first question, is there a combination of hepatitis A and B vaccination?
Yeah, fortunately there is a hepatitis A and B combination. That also is taken at the 3 series injection. You take it now, 1 month, and 6 months later.
Okay. So 现在我们的市场上，我们有这个 A 型肝炎与 B 型肝炎的混合疫苗，它注射的那个次数也是3次，第2次与第3次的注射是第1个月后与第6个月后。So is this vaccine safe and effective?
It is very safe. It is very effective. In fact, hepatitis B is actually given to newborn babies. It will last you 10 to 15 years without any issue, and the side effects are very rare. In fact, it's almost none. It's in our guideline as well.
Okay, so 这个疫苗是非常安全，也有效的保护我们的身体，避免我们遇到这个B 型肝炎的。Who should get vaccinated on your opinion?
Okay, for both hepatitis A and B, in fact, we actually recommend for those that goes for frequent traveling, those vivid travelers, those that travel often, we should recommend those people to get hepatitis A especially, and also hepatitis B if possible. But in terms of the other group that who I think should get eliminated is those in the immunocompromised, those like with a background like for example diabetes, those with chronic liver problems, those who should get themselves vaccinated for hepatitis A and B as well.
那些如果有计划要出国旅行的话，或者是一些免疫力比较没有这样强的病人，我们都是鼓励他们接受这个疫苗的注射。一些从事比较高风险的工作，例如医护人员，我们也是非常鼓励他们接受这个疫苗的注射的。What are the current recommendations for hepatitis A and also B vaccination?
This is a bit of the follow-up, I think, with the previous question that the person asked. I mean, when you ask who should get it and what are current recommendation, the WHO, the CDC, and in fact our Malaysian Ministry of Health actually recommends everyone getting it. Hepatitis B is actually is in our compulsory immunization program from the time you're born and up to 18 years old. But for hepatitis A, it's actually an add-on and recommended when you are 6 years old. But when we come to adulthood, because this vaccine don't last don't last a lifetime, so when we come to adulthood, we recommend everyone to get revaccinated so they can protect themselves and also their loved ones.
Okay, so 现在我们的政府是建议全部人都需要注射这个 B 型肝炎，所以在我们的政府的疫苗计划里面，全部的新生儿都需要注射这个 B 型肝炎。可是到了你的成年的时候，我们需要根据到底你的身体有没有足够的抗体，因而需要继续注射额外的这个疫苗。What are the side effects for hepatitis A and B vaccination?
The side effects for both the hepatitis A and B vaccine injection is actually very rare. In fact, if there is also, it's very mild, resolved in a day or two. A small percentage will probably complain of big fatigue, they feel a bit mild fever, but that's very small percentage. But most of the time, they will feel that pain over the injection site. That's pretty much it.
So 注射这个疫苗只有非常细微的一些反应，例如好像发烧，身体酸痛与注射的地方有一点疼痛而已。Is it harmful if I get an extra dose of hepatitis B vaccine or repeat the entire series?
I get that question quite a lot because what happened is for hepatitis A and B, as you can see, it's given in the period of 6 months. And a lot of people sometimes they forget when is their next dose, when is their next date. There is no harm at all to get yourself an extra dose or you repeat an entire series.
Okay, so 其实重复性的注射 B 型肝炎其实是不会对我们的身体有任何的害处的。So anyways, I can tell if I'm protected from hepatitis A and also hepatitis B.
Yes, you can. In fact, there's actually a blood test that's called as hepatitis A antibody and hepatitis B antibody, where it detects your level of protection in your body. You can get it done in your hospital. That will tell you whether you are protected from both hepatitis A and B.
So 我们要怎样懂我们自己是否免疫了？So 唯一一个那个就是我们需要抽血，然后在那个抽血里面我们要验证看到底我们对这个 A 型肝炎或者是 B 型肝炎的病毒到底有没有了这个抗体。如果呈阳性的话，那么就是说你已经有足够的抗体，而你也是已经免疫了。OK。